This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo. The drug hydroxychloroquine was found not to prevent COVID-19 in its first large clinical trial. The new study, described as rigorous, remotely tracked 821 people who had been exposed to known infected patients, either healthcare workers or people caring for sick family members at home. Researchers were hoping that hydroxychloroquine would either ameliorate the infection entirely, block it from replicating, or make the disease milder. But there was no difference between patients who had taken the drug and patients who were instead given a placebo. Of course, President Trump claimed to be taking the drug as a preventative measure and has heavily promoted its use.
The frontline workers, many are taking it. I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine.
When?
Right now, yeah. A couple of weeks ago, I started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right, I'm not going to get hurt by it. It's been around for 40 years for malaria, for lupus, for other things. I'd take it.
That sounds from a few weeks ago, of course, and the president said he's no longer taking those doses of hydroxychloroquine. I think he was criticized originally when he came out with that because a lot of doctors were saying, like, this could not be good for your health.
Well, this, in fact, was what Dr. Cohen said, that hydroxychloroquine, there's no reason it should help with the virus because it wasn't designed for that. It's an antiparasitic drug. But in terms of hurting him, it didn't hurt him, apparently.
Right.
Unless, somebody figures out a way to pin the Bible photo op on, induced by hydroxychloroquine dosage. But this would not be the first time, though, somebody took some kind of cure based on faith. It didn't hurt them, but it didn't help them either. A lot of people take mega doses of vitamin C. Who knows if that does any good or not? The only problem was that when Trump first said he was taking it, somebody went and used a fish parasite chemical or something because it had the same ingredient. That's always a bad idea, no matter what the context.
And by the way, hydroxychloroquine does help people who have lupus and arthritis. Of course, it's an anti-malaria drug as well. The president, though, says this is not the end of hydroxychloroquine research. The president sent 2 million doses to Brazil just on Sunday for patients and healthcare workers there.
Which means that all these people will not get malaria.
That's right. Israel's parliament has shut down after a lawmaker and his aide tested positive for the virus. Officials are reviewing security camera footage to figure out who Mr. Abu Shahadeh may have had close contact with while he was contagious. He was feeling tired, not showing symptoms. He had also attended 2 large funerals where he wore a mask for the majority of the time, but removed it during speeches and while crying. Now, it's not just the Middle East where there are a number of new cases either. There are new virus hotspots in Latin America, Asia, Africa. Worldwide, we're seeing more than 100,000 new cases reported every day. And even though the spread of the virus has slowed in other places that were hit hard early on, twice as many countries have reported an uptick in cases as have reported declines in recent weeks. Dave, I wonder, are these sort of new spikes, is this as the story kind of fades into the distance? People are starting to ease up perhaps on some of their fears about the virus.
Oh, probably. Yeah. It gets old staying isolated for months and months and months. It also may be because the testing has increased. And so with increased testing, you'll see more cases. I think the thing you want to track is the number of people who end up in the hospital because of this. And of course, the number who die. And that's going to take time. And I don't believe there's any agreement yet on if someone who has another condition dies while having COVID-19, do you automatically attribute that to COVID-19? Or do you say, well, we put an asterisk there because there was another serious condition that was present at the same time?
Yeah, that's a good point. I know in King County, the medical examiner out here has actually been going back to deaths that happened earlier in the year, before the pandemic really took hold, and looking at some of the death certificates. And I don't know if they're altering them, but I know that they've had, I want to say it was something like a quarter of them had COVID. And I don't know if that's going to change their cause of death, but they're looking back at previous deaths from earlier this year. The Bill and Melinda Gates Foundation has pledged another $1.6 billion for vaccines, bringing their total funding now to $5.7 billion. There's $100 million specifically for COVID-19 vaccines in low-income countries. Bill Gates did have to address a question, though, from reporters about a conspiracy theory that's been going around. There's this Yahoo News poll that surveyed Republicans and found 44% believe Gates wants to use a COVID-19 vaccine to secretly implant microchips into the arms of billions of people. The purpose for this, they say, is to monitor their movements. Gates calls these theories stupid and bizarre.
I'd say it's ironic if you take somebody who's doing their best to get the world ready and, putting, in my case, billions of dollars into these tools for infectious diseases and really trying to solve broadly infectious diseases, including those that can cause pandemics. But that, we're in a crazy situation, so there's going to be crazy rumors.
Of course, that's a very fringe conspiracy theory. It has obviously been widely debunked. But I mean,
how do you know? How do you know? Has anybody really checked their arm after their shot?
Microsoft software is pretty high tech these days, I know. So
yeah, I'd be surprised if Bill Gates was trying to secretly implant chips in people through the shots. I wouldn't be surprised if he was secretly signing up people for Microsoft Teams accounts, however. Maybe that's the underlying motive.
But I mean, this whole thing does lead to some other questions about misinformation around vaccines and other conspiracy theories, of course, about Gates' role in the coronavirus. I just hope people fact check these things and realize that this isn't happening. This is a absolute ridiculous conspiracy theory.
Well, if you believe it, don't get the vaccine. What can I say? Don't get the vaccine, and you take your chances. We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast. You can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.